but they're the same. If you know, you will find the same parts, and you will know how they work. Again, adult equipment is the same, only size is different. All principles are the same. So this is flow inflating, this is self-inflating bag. Self-inflating bag always inflated, and it doesn't need anything to be inflated. So it can be used in ambulance, at the road incident, at home, at the hospital when there is no gas, no electricity, etc. So this is universal equipment which is recommended to have in any hospital settings. Okay? This equipment is different, and to make it function you need gas source. Okay, compressed gas source. Otherwise it will not work. Okay, so to operate it correctly, you should know how it works. Do you know?
Yes.
To press
How to fix.
This bag has many valves inside. This one doesn't have any valves inside. So to make this bag working, for example, you need to connect. This is regular oxygen tube. You're going to connect it here. And you may put here not oxygen but air. If you have a source of compressed air, you may put here air. Then you have a flow. Okay, but to fill this bag, you must create a seal. Okay, because otherwise it's coming here and escaping here. No inflation. To inflate, you must create a seal. And if this bag will start inflating, it will tell you that you created a good seal. It's not for this bag. It's always inflated, and you don't know if you created a good seal. Another advantage of this bag, if you put it like this and create a seal, you already have CPAP. Okay, because it's constant flow, and this flow creates pressure. And you may use this device. Yes, and now you will see CPAP pressure. And if you need, you may immediately start ventilation, because bag will be inflating with this. Okay? And this is CPAP, and if you need to resuscitate, you may start ventilation immediately. Again, if you remove this like this, you have oxygen coming to the baby. All this impossible with this bag. There is no flow inside. Okay? Flow only when you squeeze it. Because there is a valve here and valve here. And when you squeeze, it will block this side, so nothing can go this way, but everything is go this way, to the patient. When you release, it's just opposite. It will be open, it will be blocked. This will be blocked, and what is exhaling out of patient's lung will go outside of the bag, not coming inside, decreasing the concentration of oxygen, even room concentration of oxygen. So that is why with this bag, as soon as you put mask like this, you should start ventilation. Otherwise, you are creating asphyxia. With this bag, you can put and have CPAP. Baby is breathing, and there is a flow, there is a gas exchange. With this, there is not. And if you put like this, no oxygen. Okay? So, pressure which you will create in patient's lung will depend on the flow. The higher the flow, the higher the pressure. And second point, your strength, your power with which you will squeeze the bag. Usually, it's recommended to use fingers for ventilation, not like this regularly, okay? So you should use the minimum number of fingers which will create enough volume in the lungs. Again, the main criteria of effectiveness of lung ventilation is heart rate. Okay, so you may use this to this bag as well. And modern models of bags usually have manometer which is built inside. So, this is so-called anatomically shaped mask. Yes, it must be put like this, nose inside, not like this, okay? Like this. Okay, then and on. I see. There will be no pressure, so we must be cautious about that. Then we see we are providing ventilation. So rate of ventilation 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. You see, it's just a little bit pressure, but you see movement of the chest, and you must be able to create such movement. Hardly seen. So rate, to maintain rate, you should use counting. 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, not like this. Okay? It's very effective, but lungs are dead after 5 such breaths. Yeah. Sometimes people are very proud that they are providing such a ventilation, but okay, 30 seconds passed. I must remove mask. Okay, and must auscultate heart to define heartbeats. If it's less than 60, yes. Oh, with ventilation. So there are 2 methods of chest compression. This is recommended and most effective. I support the back with my fingers, and I'm using 2 thumbs. The thumbs method, so called. Yes, I must locate area. Area is located just above processus xiphoideus. Okay? So I must leave this space, not like this. I must use minimum area to create pressure, because otherwise I can break the ribs. So I'm going to count. As soon as I say back, you should ventilate. Okay, so 1 and 2 and 3 and back and 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 okay. So it's like it's supposed to be. Depth 1/3. You should stay in touch. You should release the chest at the pace of decompression. Compression, decompression. You completely release the chest. Okay? And if your finger is too large, you may put one over another one. 1 and 2 and 3 and breath and 1 and 2 and 3 and breath and 1 and 2 and 3 and breath and 1 and 2 and 3 and breath. Like this. If you need to put catheter to infuse adrenaline, you should use this technique. Now I open this site for access of the third person, which is going to put catheter inside of the vessel and then to infuse adrenaline. So the same, the only position. Not like this, not like this, like this, okay? Vertical, not like this, like this. 1 and 2 and 3 and back and 1 and 2 and 3 and back and 1 and 2 and 3 and back and 1 and 2 and 3 and back.
So each vessel are you putting adrenaline?
In vein. There are 2 arteries and 1 vein in umbilical cord. Usually in our body we have 2 veins and 1 artery. Here we have just opposite. So you must be able to find it. You should not infuse adrenaline into artery. So vein is usually larger and walls are thinner. Okay, now your task for everyone to do ventilation, to do chest compression, because you will have to demonstrate it to me during the final model evaluation. Okay, go ahead. So work in pairs.